Ever wondered how trigger finger gets unlocked? The answer is surgery. First, let's make it clear what trigger finger is. It happens when the tendon in your finger gets stuck due to inflammation. This inflammation makes the tendon thicken a little, causing it to not slide smoothly through the surrounding tissue. As a result, you'll find it hard to straighten or bend your finger freely, and sometimes when you try to move it, you'll feel it get stuck. You might even need to use force to get it moving again. The main goal of this surgery is to release the trapped tendon so that the finger can move normally again. The surgery starts with local anesthesia. The doctor will inject anesthetic into your hand, and after a few minutes, your hand will go numb. Next, the surgeon will make a small incision. This incision is usually very short, only about 1 centimeter long. It is either made at the base of the affected finger or in the palm area near the finger. Inside this part of your hand, there is a tight band of tissue called the A1 pulley. This pulley is like a small tunnel through which the tendon passes. When the tendon becomes inflamed and thickened, this tight pulley blocks its movement, which is why your finger gets stuck. The surgeon will carefully cut this A1 pulley. The incision is very precise, just enough to loosen the pulley so that it no longer presses on the tendon. Once the pulley is cut, the pressure on the tendon is immediately released. This allows the tendon to slide freely in this area again, just like before the inflammation. There will be no more sticking or catching. In some cases, instead of using a traditional incision, the doctor will perform a needle release. This method uses a thin, sharp needle to make a tiny puncture in the skin. Then the doctor will guide the needle to the A1 pulley and cut the pulley through this small puncture. Needle release is faster than traditional surgery and less invasive. Once the tendon is successfully released, the doctor will clean the surgical area to ensure no debris remains. If a traditional incision was made, it will be closed with a few fine stitches. If it's a needle release, only a small bandage is needed to cover the puncture. Right after the surgery, the doctor will ask you to start doing gentle finger movements. This step is very important because it prevents the tissue around the tendon from getting stiff during the healing process. Most people recover well from trigger finger surgery and can usually go home the same day without needing to stay in the hospital overnight. For the first few days after surgery, there may be a little soreness or mild swelling around the surgical site, which is normal and will gradually subside over time. Have you ever had trigger finger, or do you know someone who has?